If you find yourself in the position where I'm the one who's telling you you've screwed up, you're gonna know it's bad.
She's really mean.
Richard. Nice job, everyone. Patient is stable and ready for x-ray.
Too slow. You guys are gonna need to be much faster because the next patient...
What? That was like the fastest trauma evaluation I've ever seen.
We're a 28-year-old male with extreme abdominal pain, low BP, and heart arrhythmia.
I just released him. Brandon, can you hear me? Wait, did you take the meds we gave you?
Ooh, okay, so... Hey guys, my name is Jamie, and I'm an emergency medicine physician in New York City. And today we're going to be reacting to New Amsterdam's new season, Season 4, Episode 1. Let's get started.
Okay, listen up, newbies. I'm Dr. Lauren Bloom, head of the emergency department, which means do not come to me with your personal problems. Don't complain to me about your schedule, and don't expect me to care if your pet is sick. Chief Resident Walsh will field your questions, let you know when you screwed up. If you find yourself in the position where I'm the one who's telling you you've screwed up, you're gonna know it's bad.
She's really mean.
Questions?
Dr. Bloom's head of the emergency department, so she's like in some chair or some like higher up position. You would hope that they're welcoming to new residents, because new residents make mistakes, they're learning, but you want to like make sure you're in a nice, nurturing, supportive environment. So you wouldn't necessarily make this like mean speech. I don't think it's very conducive to your learning environment, your work environment in general.
Look, I know your internships were a long, hard slog, and right now you probably feel like you're seeing light at the end of the tunnel.
So the way she's explaining that, it makes it sound like they're actually second-year residents. So generally speaking, first-year residency is called intern year or internship, and then afterwards is rest of your residency. So the way she's talking about it, it sounds like these residents finished internship and are now technically second-year residents.
I'm here to tell you that is not daylight. It is a train. So grab a donut and get to work.
Okay, so I'm Dr. Mark Walsh.
And just so we're all on the up and up, Resident Shamwari is my girlfriend.
Ooh, interesting plot twist. It's a weird power dynamic, right? Someone is the head of the department and the other person is a resident in like a more vulnerable position. This would be most likely an issue to have a romantic relationship with a resident and head of the department. And she probably wasn't expecting that this announcement was going to be made, which is, you know, it's unfair.
Brandon?
Hi. Well, yeah, it looks like you've got gout.
It's so interesting that she is so mean to the residents, but when she's like talking to the patients, she's like all of a sudden super nice. People definitely take on multiple roles in the emergency department. Sometimes you're a teacher, sometimes you're the doctor talking with the patient, sometimes you're counseling family members. There's multiple roles, and this like kind of very duplicate personality, I feel like would really throw me off as a resident if this were my attending.
It's like some old-timey disease, right? Fancy people sitting around eating all day.
Yeah, not so much anymore. Just like halter tops and headscarves, young people are bringing it back.
Nah, I shouldn't be up in here with no gout.
So gout happens more in males. If you have other medical problems, it does make you more prone to gout. Certain food choices, beer is like a poster child of like problem child of gout, but red meats and seafood and other things can cause gout. Basically just inflammation of joint spaces, most often or classically in your big toe, but it can happen in other joints also. Forms like crystals, it's really painful. It can be swollen, red, and really uncomfortable.
I'm an athlete. I'm in shape. You know, my team was in the Final Four just 10 years ago.
Yeah, so I mean, most of my gout patients that I've seen are a little older, but doesn't mean that it can happen in younger people, especially athletes, because they probably have a diet pretty heavy in protein, so it can put you at more of a risk.
Wendy Sturrell, vaccinated. Multiple fractures, lacerations, concussion. Fell backwards off the fire escape while taking a selfie.
Maybe she was doing what she loves.
Walsh, let's get her to Trauma 1. Tehran, can you take over with Brandon? He needs 2 doses of ibuprofen every 5 hours and 3 doses of colchicine every 8 hours. Write it down so he gets the timing right.
So she is prescribing appropriate medications for gout, so ibuprofen, colchicine. In the emergency department, you don't typically schedule them every 5 hours or every 8 hours or whatever the interval may be, because you usually treat and then you send them home with a prescription that says take this every 8 hours or every 5 hours.
We're less than a year away from needing our own selfie wing.
What do you got? Let's hear it, people. It looks like a tidbit.
So this is the chief resident who is, it sounds like maybe is going to be running the trauma. We talk about trauma maybe almost every episode in different reaction videos, but very regimented approach to trauma and how it's evaluated in the emergency department. The person running the trauma will be at the foot of the bed, and you want to hear exactly like airways intact, breathing is intact, circulation intact, and then you go through the trauma survey of A, B, C, D, E, and so forth. So let's see how they do that.
Fracture with some intense reactive inflammation.
Placing a chest tube to evacuate pneumothorax.
Shinmari?
Arm is irrigated and soothed.
Wow, that is very fast. She just got there. So it looks like they're doing kind of multiple things at the same time. Someone's putting in a chest tube, someone is doing a laceration repair, someone's talking about a fracture. You want to approach trauma very systematically, address the most important things first. Things like a small laceration that you're not bleeding out from usually will be dealt with last.
Nice job, everyone. Patient is stable and ready for x-ray.
Too slow. You guys are gonna need to be much faster because the next patient...
What? That was like the fastest trauma evaluation I've ever seen. That type of comment is not helpful or constructive during an active trauma. If anybody has any kind of criticism or constructive feedback, it's best to do it after the trauma is done and the patient has been appropriately dispositioned to either OR or admitted or home or whatever the case may be. Usually not appropriate to just shout out like criticisms like as the trauma is actively happening.
All right, let's mobilize for radiology. Trauma 1's a busy place. Got to clear the room.
It's true. Usually every emergency department has either 1 or 2, sometimes 3 of these recess areas where someone really sick comes in, whether it's trauma or a stroke or maybe altered mental status or whatever it may be, when it mobilizes all the staff members. There's one specific room that they go to where it's a little bigger, you have a lot more equipment in the room so that you can take care of the patient really fast. And like he said, ideally you want to move the patient out so that if there's somebody else that comes in, they can use the room.
Brandon Dover, 28-year-old male with extreme abdominal pain, low BP, and heart arrhythmia.
I just released him. Brandon, can you hear me? Wait, did you take the meds we gave you?
Ooh, okay, so let me work this out. This guy was seen for gout, was given ibuprofen and colchicine, and was presumed discharged. Now he is essentially bouncing back. Bounce back is a term that we use in the hospital when patient is discharged, but then they come back to the hospital because either there's an issue that the first visit didn't address, or maybe the intervention did something else. Usually it's something we kind of dread. We don't want to miss anything. We want to make sure that when patient is discharged from the emergency department or the hospital, that they feel better and they don't have to come back to the hospital.
We got a bleeder.
Wow, interesting. Doctor.
Got it. Suture.
Is that Dr. Blue in surgery?
Scissors.
Appendix, liver, spleen, arteries, they all look fine.
They're rock hard.
Ischemic lupus bowel?
No sign of
Cool.
thrombus or infection.
Well, he came in for gout. We gave him medication.
Didn't help.
What if the pharmacy...
So interesting. Again, this happens a lot in medical shows where the doctors don't follow their own specialty, but they do like multiple things. So Dr. Bloom is obviously an ER physician, but now she's like scrubbed in surgery, which would never happen in real life.
Maybe you didn't have gout.
I saw the crystals myself.
How do you see the crystals yourself unless you take out the fluid? So in gout, like I said, it's inflammation inside the joint space, and sometimes you can... The definitive way to diagnose is if you take out the fluid from the joint and you look at it under a microscope and you can see crystals. Or sometimes you can just do a clinical diagnosis and you don't have to do all the procedure of taking out the fluid and looking at it under the microscope. You can just clinically diagnose gout. maybe of something else.
Okay, well, what if he did take his meds, but maybe he took too many?
Why would he OD on culture scene?
How's your first day going?
Are you serious? It's bad enough you gave me a medal for cleaning out a wound, but why'd you tell everyone we were a couple?
Yeah, okay.
We agreed to wait until they got to know me as a resident.
Yeah, I would say Dr. Bloom put her in a really awkward position. Not only do you hear on your very first day, and like all the rest of the residency knows that you're dating the head of the department, it makes other residents think that maybe you're getting special treatment and like she's the only one that got a compliment in the trauma room. It puts her in a really awkward position.
You're going to treat me like everyone else.
But you're not like everybody else. You're a fully trained doctor. We're just a bunch of kids pretending to...
So the backstory is that this other doctor is actually a fully trained doctor from a different country, but because she is now in the US, she has to do her residency all over again, which is something that my dad had to do. He was a fully trained orthopedic surgeon in Korea, but then when he came to New York, he had to start over his residency, take the step 1, 2, and 3. It's usually kind of a painful process because you were fully functional, like you were a fully functioning physician, maybe even had your own private practice or you were practicing it independently, and now all of a sudden you have to come here and you have to work under somebody else and kind of deal with this kind of like hospital politics, which can be annoying. So that's interesting. It looks like the patient is given a HIPAA form, but then when he reads it, it turns into gibberish. I'm guessing he maybe has dyslexia.
When I was younger, nobody cared about my education. As long as I could ball. Not the school, not the coaches. I was their meal ticket. It's always been that way, even throughout college. Nobody wanted to hear about my dyslexia. Couldn't even get it diagnosed. When I blew out my knee, that was it. I couldn't play, couldn't keep my scholarship, couldn't read.
That's really unfortunate. This is why it's so important when you tell patients any kind of direction before discharge, that you do what's called a teach back. So you tell the patient what you want them to do, and then you want the patient to tell you what their understanding of what they're supposed to do so that you can make sure you're on the same page. It's really easy to assume everyone knows how to read or everyone knows how to, follow directions as long as I write it down really clearly, but clearly that's not the case. This patient would have really benefited from another doctor going to him before discharge and saying, now tell me what you're going to take and how often, and making sure that he really understood the instruction before going home.
Shimori, you left the O2 sat meter on the counter. It always has to go back in the wall, in the receptor, where it belongs. The next time an asthmatic comes in, sucking for air, I can't be hunting around trying to find it. You got that?
I don't know. Their dynamic is just like really awkward. I guess she's just trying to make up for the fact that she gave her a compliment and now she's like yelling at her about something. So that's it for New Amsterdam Season 4, Episode 1. I'm really enjoying the show, so hope you guys are enjoying it too. And let me know if you guys like these reaction videos or if you have any questions. And I will see you guys in the next video. Bye!